Hello, everyone, and welcome to our first ever Wellness Watch Wednesday. We just want to thank you for taking your time to view our video, and I just wanted to give you some housekeeping rules and regulations just as we start. So, as I mentioned, this is our first ever Wellness Watch Wednesday. We anticipate that we will do these twice a month, and we're going to have different Newman Regional Health experts with us, joining us for different health topics, wellness topics, as it relates to just the environment that we're in right now. So joining us today, we have Ester Knobloch. She is our infection preventionist for Newman Regional Health. And we have Dr. Oyenuga, who is a member of our Hospitalist program here at Newman Regional Health. So we are dedicating today's program to COVID myths and truths. So let's go ahead and get started. So our first question is going to be in relation to quarantine and isolation. So can you guys just talk a little bit about the difference between quarantine and isolation and the length of time associated with those?
Okay. So technically, isolation is basically defined as when you've had the disease, the person in question has the disease, the period of time you have to stay away from other people, basically be on your own, not be exposed to other people. Quarantine is basically related to people that have been in contact with a person that has been sick, and how long they have to stay away, kind of watch themselves, temp themselves, check their oxygen, basically just temp themselves and check for symptoms before they to see if they kind of like get the disease. That's the difference. And there's a time duration that is different between isolation and quarantine, and I'll let Esther speak to that.
Right. So, like Dr. O mentioned, isolation are for those who are ill and infectious, and quarantine is for those that have been exposed. So both of these are methods for us to prevent the spread of disease by keeping those that have the illness isolated away from others, or those that have been exposed to the illness away from other individuals so they don't spread it should they become sick. Typically, historically, isolation has been 10 days and quarantine has been 14. Last week, the CDC did make some adjustments to the requirements for quarantine, and they have reduced that period. The state of Kansas has given that opportunity to opt in or out of those CDC guidances. They've let that up to each county, and so every person would need to reach out to the local public health officer for their individual county to determine how long the requirements for quarantine are.
I feel like just within our community, quarantine is such a well-known term. So even when someone's positive, they're like, well, I just got out of quarantine. And I'm like, no. You were in isolation. So I think that there's just still some kind of confusion on those terms. So thank you guys for clearing that up. Let's talk about how the virus can be transmitted. So I think there's a lot of confusion on how it can be transmitted. And is that only through close contact, or are there other methods for that as well?
It's not just through close contact. We've seen it happen over and over again, and there's been research that has shown it can be through close contact. It could be while you're outside, it could be dining in a restaurant, it could be outside. It doesn't have to be with in room or just close contact with an infected person. So I think that's a myth.
Anything else? Okay. Let's talk a little bit about a saline flush. So there's some talk out there about how a saline flush can prevent the transmission of the virus.
So that would be a myth. We know that the way the virus spreads, it enters the mucous membranes, and that's how it causes infection. If you had the virus and it had entered your cells, a saline flush will not remove it.
So there's also talk out there about when you have COVID, you fully recovered, and then your virus becomes dormant or dead. Can you talk on that?
So that is a myth. Esther will also throw some light on that. There has been, when you have the virus and you're considered COVID recovered, the virus doesn't become automatically dormant in you. It doesn't mean you can't infect others or you can't get reinfected. So there's a myth to that. There's still the possibility you could infect others. There's still the possibility you could get infected. I know there's some studies that show, because historically other viruses, there's been a 90-day window where you're kind of not supposed to get reinfected, but COVID is gradually evolving. We're still learning so much about it. So I wouldn't hang my hat on the 90-day rule. Except Ester has anything else to say about that.
Right. So I think maybe individuals are getting confused with the virus becoming dormant and their immune system having an antibody that fights against the virus. So when a person becomes recovered, it's not that the virus has become dormant or dead. It is that their immune system has mounted an appropriate response and has contained it.
So at that point in time, the way that they can infect others, or if they were contagious, that phase is kind of over at that point?
Correct.
Okay. So another thing is, the bigger the exposure, the bigger the virus load. Or, if I am with you for 2 days, but I'm only with you for 10 minutes, you both are positive, obviously I'm going to have more of a worse case of COVID with you because of that longer time. Can you speak to that?
So there's many different factors that determine an individual, how sick they become and what their disease course looks like. But definitely the viral load that infects them makes a difference. And the thing to remember is that the exposure to COVID is cumulative over time. So every infectious disease has what's called an infectious dose. And that's the amount of the virus that's required to overwhelm our immune system and make us be sick. And that's cumulative. So if I get a little bit here and then a little bit here and a little bit here, that will add up until it overwhelms our immune system. And so again, that brief moment in time, maybe the exposure that we have isn't enough to create a sickness, but if we're a extended exposure or a high dose with sneezing or coughing, then that would have greater viral particles in it, and it could overwhelm our immune system. And there are studies that show when we do the swab to look for COVID, those that have a lot of viral particles in their swab versus those that have just a little bit of viral particles in their swab, those that have high viral loads, they do usually get sicker.
Huh. Interesting. Okay. Thank you for sharing that. Let's talk about kids. There's so much talk about, can kids carry the virus and can they transmit the virus? Can you speak to that?
Yes, kids can carry the virus. Yes, they can transmit the virus. It looks like, from when we started kind of studying COVID, it looks like kids have had a milder disease than adults, and that's basically because of the ACE receptor on their cells. It increases the older you get. So definitely, if it's going to increase the older you get, kids will have less of ACE on their cell receptors and the cell surface, which is what basically the COVID virus attaches to cause the infection, which is why it seems like kids have a milder version of the illness. But yes, they can carry the virus. Yes, they can transmit the virus.
Okay, good to know. There's some talk about how COVID has some seasonality to it, just like we've kind of come to see with the flu. So talk a little bit about COVID's transmission in both warmer temperatures and being outside versus inside.
So with all the respiratory viruses, we do see seasonality. It's worse in the winter than it seems to be in the summer. Couple of things for that. First of all, in the winter, we're all congregating inside. We have closer interactions with people, so it spreads easier from person to person. And then also in the winter, the air is drier, and that can thin our mucous membranes, which is one of the first lines of defense that our body has, and so viruses can easier penetrate and cause illness. But it's not that they can't be spread in the summer. If the virus is present, it is definitely possible to transmit regardless of the temperature.
Anything you'd like to add on that?
No, I think it's spread tropical climates, temperate climates, it can be spread either way.
Okay. The treatment of COVID. Is antibiotics a treatment?
Antibiotics is not a treatment for COVID. And some patients have bacterial pneumonia superimposed on the COVID virus infection. So then the antibiotics basically fight the bacterial pneumonia they have on top of it. So no, it's not routine for us to give all COVID patients antibiotics.
So if a COVID patient is receiving antibiotics, it's to treat something different than the COVID virus itself.
Yeah, it's to treat the bacterial pneumonia. Some people have a viral pneumonia, but if they have like a little bit of if basically infectious markers are positive, then we add antibiotics. So it's not to treat the COVID, it's to treat the superimposed infection.
Okay.
Mackenzie, I'm so glad that you asked that question. Just to get it out there, I mean, November was Antibiotic Awareness Month, and it is so important for the community to know that antibiotics don't treat viruses, and people should not pressure their physicians to give them antibiotics to treat viruses, because that can create other complications. Antibiotics aren't without harm. They're an incredibly useful tool to treat those bacterial infections, but we don't want to just give them willy-nilly. We want to make sure that they're being used to treat bacteria, and the physicians are the best ones to make that determination.
I think that's helpful to know too, because if a lot of people do go to their doctor's office or an express care clinic and they are positive for COVID, I think they automatically assume that they could be given something to help them with their disease course, and that's not the case with COVID. So that's good. So we know, and we've seen within our own facility, that a lot of patients are really delaying their care throughout this entire pandemic, and it's really causing a lot of future problems for them as a patient. A lot of those services are preventative services, so it's helping their bodies to take care of those things that they need to take care of at that time. So it's worsening those problems as we go into the future. So there's a lot of talk about how hospitals and doctor offices aren't safe during this time because we have patients that are positive, and we're caring for patients during this pandemic. Can you speak a little bit about the safety of hospitals and doctors' offices right now?
So I would say that the first wave we had of COVID, we saw people delay care in coming, and the back end of that, we have already experienced this. People came in much by June, July, August, in the thick of summer. People came in much sicker because they weren't getting their wound care, they weren't going to get their hypertension treated, they weren't going for their routine care to get, like you mentioned, to keep your health there. They weren't getting their diabetes checked out. So they came in real bad crisis mode. So it was much harder and some of them had negative outcomes. It was much harder to care for them at that point than if they had sought their regular routine care when they kind of felt they were starting to feel sick, just coming into the emergency room or seeing their primary care doctors. So the doctors' offices are safe. They're taking the appropriate precautions. We have they're being tamped, they're being cleaned, sanitized. Everybody's taking appropriate precautions in the hospital. The doctor's offices, the emergency rooms, the hospitals itself, in-house. We're taking all the appropriate precautions, so I don't want anyone to delay any form of care. If you feel you're sick, if it has to be, you see your primary care doctor. If he wants you to go to the emergency room, he or she will send you to the emergency room. So we're appealing to all our patients and people in the community. Please do not delay your care. Don't put off your health care, medical care, obstetric care, whatever form of care you're supposed to get. Please don't put it off because of COVID. Go see your primary care doctors when you're supposed to see them. If you start to feel sick, get in touch with your primary care doctor or come into the emergency room or urgent care as indicated.
Right, yeah. I mean, my whole role here at the hospital as an infection preventionist is to prevent the spread of infectious disease between our patients and our staff. So it's a role that I take very seriously. I feel the weight of that responsibility, and safety is our utmost priority. I feel like our hospital has been very aggressive in implementing all the safety measures that we need to keep everyone safe. And so, as Dr. O said, it's so important not to delay care.
Good strong message. How about getting it twice? Can people get COVID twice?
Yes. We have seen that over and over again. So that's a truth. People can get COVID twice.
Okay. Oh, what about the if you hold your breath for 10 seconds, you don't have COVID? Shall we try?
I'm not going to try, but I know that's a huge myth.
Okay.
That's a myth.
Okay. So sure, feel free, give it a try, but it's not going to tell you whether or not you have COVID. Okay, talk about the difference between the tests. So we know that there's a nasal swab test, and we know that there is a saliva test. I think there's some belief out there that one is better than the other. Can you just touch on that briefly?
Right, so there's different sample types that we can look for COVID in, and you've mentioned two of them. There's the nasopharyngeal swab, which goes way deep back in the nose. There's just the nair swab, which is just an inch up into the nose. And then we can do a throat swab, and we can also do saliva. So there's multiple specimen types. There's been a lot of studies about what sample type is the best for collection. I think that all of them provide us with some answers, There is difference, though, in how quickly we can pick the virus up. So some of the studies show that as you're entering your disease course, we can pick it up from a deep NP swab about 24 to 48 hours before we can find it in the saliva. So the timing of when a test is collected does make a difference on how, quote unquote, good that test is. They all provide us with diagnostic answers, but the timing might make a difference. There is different, as just like there's different types of samples, there's also different types of testing. So PCR is looking for the genetic signature of the virus. That test is well documented to be the most sensitive and specific. Then there's also antigen tests, which is looking for the protein markers of the virus. That's a good test, maybe not quite as sensitive and specific as the genetic test. And then there's also antibody tests, which that is looking to see if the immune system has mounted a response to the virus. And that also serves different purposes.
Good. So once a confirmed positive, can a person test positive for up to 3 months after they've been labeled as recovered?
Yes, it's possible.
Okay. So I find that interesting because so often we hear about employers or workplaces that are requiring their employees to have a negative test before they even return back to work. So, I think that also can create some confusion.
Not only if just basically they say you're COVID recovered if you're positive 10 days after or a day after 24 hours when you have no fever, you're fever free. If you continue to test, it's possible to continue to test positive and you're recovered after you have all of that. The only problem is if you start to have new symptoms is when we say, okay, maybe you're still in a prolonged COVID illness. But once you're fever-free, you've gone through the 10 days of isolation since you had the disease. You've gone through the 10 days of isolation and been fever-free for 24 hours. We typically call you COVID recovered.
Okay. So that's why we're so often just using that 10-day window instead of requiring a negative test.
Yeah.
Okay, great. Well, I think that covers what we have on our list. Is there anything else that the two of you would like to touch on or mention?
I just want to again reach out to the community and thank them for everything that they've done. I know that this has been a really long ordeal. Day continues to follow after day, and I understand that it does get wearying. The masks aren't the most fun to wear, but it is important. It is important. The social distancing, the hand hygiene, the mask wearing, all of that does make a difference. And so I just want to appeal to the community, thank them for what they have done, and just encourage them to just continue on, stay the course. We'll get through this.
Awesome. Great.
We will get through it. We'll get through it.
We'll get through it together.
Together.
Yes. So I just want to take a second and thank the both of you for participating in this. I'm excited about your answers. I think that it provides, some helpful information for me, and I hope that it will provide some helpful information for our viewers. I want to thank our viewers for tuning in. And again, I just want to remind you that this is our Wellness Watch Wednesday. Hopefully we will take part in something like this twice a month, if not maybe more. If you have any ideas or topics that you would like us to address in these videos, please send us an email, visit our website, follow the contact page, and shoot us an idea for a topic, or send us a direct message on our Facebook page. You can follow us at NRH Emporia. And I just want to thank you again for tuning in, and thank you guys.
Thank you.